And so I think this particular year, the key thing that I think most folks should take away from it, at least I'll take away from it, is the continued and increased effort we need to put into mental health. All of this is 2019 data, so this all precedes our COVID pandemic. And we all know that from years of doing this, not only here but across the country, that our big stressors, when you look at suicides, you say, well, yeah, they've ended their life, but what were the underlying issues? What was going on, that drove this tragic decision? That's never the answer, but unfortunately, it's a path taken by too many. It's financial struggles, relationship problems, legal issues, and medical issues, and those are the big drivers in adults, in addition to obviously depression and those kinds of things. But when we look at social issues, those are the drivers. Well, with job loss and economic issues that have gone on associated with the pandemic and the virus, we have a lot of those psychosocial stressors out there. And so when we look at last year, in the increase in suicides, and you compound that with what we've dealt with as a country and a world with this pandemic, it's clearly an area where every community, but in particular ours, needs to focus their efforts. And I would say that's one of the positive things, one of the few positive things that's come out of this pandemic and our efforts to fight it, is that that concern and that issue of mental health has come to the forefront of the discussion across the political spectrum, across the economic spectrum. Everybody understands that's a major component that's a major front on this war against the virus, is also helping people struggle in a really a desperate time of uncertainty in many people's lives, and how we need to make sure that that's a focus of our efforts, as well as fighting the virus itself. So for me, that's the big piece. The good news is, early on, our suicide numbers are not up for this year, for 2020, in spite of the pandemic. And even during the window of the pandemic that we've been dealing with, our suicide numbers are down. Now, some people can respond during acute crisis. They kind of hunker down and do what they got to do. But moving forward, as we hopefully see success with the virus, but there is much work left to do, we'll continue to have mental health and mental well-being as a focus of our recovery and our continued efforts to get through this thing.